Hello, everyone. Welcome again to the Beauty and the Beast podcast. My name is Dr. Sal Pacella. I'm a plastic surgeon out of San Diego and La Jolla, California. And I'm, of course, joined by my good friend, colleague, and pretty respectable surgeon, Dr. Sam Jejurikar, who's in practice in Dallas. He is the president of the Dallas Plastic Surgery Institute. Today, we're going to talk about one of our favorite subjects, breast augmentation 101. What you need to know for breast augmentation. Now, this is an operation that's been in society for the last 50, 60 years, correct, Sam?
Yeah, I think that's about right. I think 45-ish years.
Okay.
50 years.
And I think Sam will agree with me, and most will agree with me, that the technology that has occurred in breast implants in the last 60 years has grown exponentially. But before we get into that change in technology, I want to talk a little bit about breast augmentation. So, Sam, tell me a little bit about your approach to breast augmentation, what you talk to patients about, what's important for them to glean out of breast augmentation.
I think breast augmentation has changed a lot, particularly over the last few years. Societal trends are changing. The saying that everything is bigger in Texas is really maybe not so much a thing anymore, where we have different distributions of patients that are looking for different things. So my first thing is listen to the patient, find out exactly what their motivation is and what their goals are with the operation. Second, the conversations about silicone versus saline breast augmentation, not so much a thing anymore. It's pretty rare for anyone to put in saline breast implants at this point.
When was the last time you put in a saline device?
I can't remember. It's been in the last 5 years, but I can't nail down the date. How about you?
About 10 years ago, really.
Yeah. But what's really changed, and this leads to a much broader conversation, is particularly in the last 1 or 2 years, there's a lot more discussion on social media about breast augmentation. One, there was a trend a few months ago where every patient that seemed to have had breast implants was posting what implant they had done. This is the Kylie Jenner effect. Have you experienced this? Yeah.
Absolutely. So what Sam is referring to is there's been social media posts where, say, patients are doing a quick video of themselves in a bikini or some sort of a dress and showing off their cleavage. And then they say, well, I had Motiva implants, I had Mentor implants. These were 550 cc's, and they were placed by Dr. Jejurikar in Dallas, Texas.
Right.
And so what have you gleaned from that, Sam?
Well, so it was Kylie Jenner that started this. She said, I have 445 cc moderate profile Allergan Natrel implants that are partially behind the muscle. She named her surgeon when she did it. And in that first 2 or 3 weeks, I had about 15 calls to the office. We're literally on the clinic notes for the consultation. They said they wanted 445 cc moderate profile implants. So I was grateful that she had actually posted that, because all of a sudden people wanted breast implants. But it led to broader conversations about how do we size people for breast implants? And is there a one-size-fits-all approach? How do you handle that?
Well, I think like anything in plastic surgery, it's a bespoke approach. There is not one size that fits everybody, right? If that was the case, we would just buy one implant, right?
Right.
And buy it in bulk.
Yeah.
By the truckloads.
Yeah.
And so to me, when I talk to patients, I say something very simplistic, okay? I have tried for many years to do sizing with patients. We've done everything from imaging. We've done taking implants and putting it into a bra and seeing what the patient looks like. And I found that none of it works. What I do tell patients is I ask them a simple question. Do you ever get your hair styled? Do you go to the stylist? Oh, yeah, all the time. Well, how do you tell the stylist exactly what you want? Well, I bring in pictures. Exactly. So picture's worth 1,000 words to me. So I direct them to my website. I direct them to his website. And I say, give me an example of breasts that you like. Give me an example of breasts that you don't like. And let's bring 5, 10, 15 pictures, and let's sit down and have a really good conversation about that, because there's so many factors, right? There is the projection, there is the upper pole, there's the cleavage. And to me, what means high profile doesn't necessarily mean that to the patient, right?
Completely right. I completely agree. I think that illustrates the importance of communication. You're using pictures as a communication tool to understand what patients like.
And you do something differently, don't you?
Well, no, I believe in communicating with my patients. Like,
No,
I
as,
think
as far as
that's
pictures goes, you
yeah.
do a lot of imaging, correct?
I do, but I
Mhm.
start off with what you're saying. I find that about 90% of the patients that come to see me say they want to look natural, and that means nothing to me at this point. What is natural? I mean, everyone's concept of natural is so different, right? And being somewhat cynical in nature, I'll tell them, well, you are natural right now. What does that mean? Everyone's concept of natural is very, very different. When you refer to patients wanting to be high profile, what they're really telling us is, I want some upper pole projection. But very few of them now seem to actually want high profile implants. So we have a long sort of conversation about, all right, if I'm going to err on the side of being too big, is that what you want? Or would you rather I err on the side of you looking smaller? And these days, trends have changed. I find that in general, patients don't want oversized implants. Patients want implants that give them cleavage, give them some upper pole projection, but they don't want them to stick out too far. So then, yes, I do rely heavily on 3D imaging. I think 3D imaging is very useful for some things and not great for other things. It's great for as a communication tool. It allows the patient to see themselves from a variety of angles. It allows you to point out the way they actually look, why they might need a breast lift, why they might not need a breast lift. It helps me give them a general sense of what they want to look like. So on their body, I'll sort of create an image of what I think is possible. What I don't think it's great for, particularly as we've moved into newer and different brands of implants, is picking the exact implant. So I'll try to create the look on the 3D image that they like of their body. And I said, okay, great. I have this general range of implants that will probably accomplish that. I know this is how you want to look. Don't get your heart set on a particular implant.
So before we take a deep dive into some of the technology of implants, I think it's important to understand there are many ways to achieve what Sam is talking about. So, can it be done through implant? Can it be done through lift? And one of the techniques that I have really been excited about the last few years is what we call a hybrid breast augmentation
Mhm.
or lipofilling. Okay. And to me, that has been an important concept. So, what that is taking a little fat, doing a little fat transfers, hips, thighs, wherever you want it from, and injecting it into the upper pole. Now, in doing a fair amount of breast reconstructive surgery, this is a technique I'm very comfortable with. And to me, it's shown me that sort of that compendium or that transition between reconstructive and cosmetic surgery. I have seen fat transfer make incredible differences in patients who have had mastectomies. And for cosmetic patients, it's even that much better because we can really dial down exactly where we want to put that augmentation. For example, if someone has a very wide chest and maybe you're talking about a 13 centimeter base width of the breast, and regardless, all of the implants that are 13 centimeters are going to be probably fairly well projected. And if they need a little bit more, we can add and sprinkle a little fat into the breast.
I
So
agree completely with that. I find it particularly useful for creating cleavage. But, and I think you would agree with me on this, I love the idea of fat transfer, but I don't think of it as an alternative
correct.
to a patient that wants a breast implant. Although there is a segment of the population that would be happy with a fat transfer as their sole form of breast augmentation, I don't find that it's a big portion of the population.
Right. And when we were in training, that was a big thing, wasn't it? They,
Mhm.
there was some surgeons out of Florida and Miami that were really touting a natural breast augmentation. I think that's kind of fallen a little bit by the wayside. Do you think?
So then here we keep using that word again, natural. But when someone comes into you and they talk to you about a natural breast augmentation, what are the things in your mind that might be suggestive of a natural breast augmentation? Like what does that mean to you as a plastic surgeon?
Yeah. So I think at least going back 5, 6 years ago, maybe our patient populations were a little different. Everything's bigger in Texas. In fact, it could be said, is Texas Titanic? Celine Dion. Come on, I'm trying to give you a little hint
I'm
here. Big Celine Dion fan.
I do love
Okay.
Celine Dion, and I'm not ashamed of that. I'm very, very secure. It's all good. Love Celine Dion. Continue.
So, the traditional joke was, Dallas, Texas, it's the land of big breast augmentation, right? It was like what Marina Del Rey was in the 1980s in Los Angeles. I would say in my patient population, we did a lot of moms, a lot of soccer moms, a lot of athletic moms that just want a little something. And the common thing they say when they refer to natural breast augmentation is, I want to look like it was when I was pregnant or before I was pregnant, right? And to me, that hints at they've lost volume.
Mhm.
And it doesn't necessarily mean that they want the implants sitting up high. They just want a bit more projection. They want the upper pole to be not so not so projected and not so augmented looking,
Yeah,
right?
it really comes down to the slope,
Yeah,
right? They want a natural slope to the upper portion of the breast.
right.
So, yeah, I agree with that completely.
So, things have changed a bit in the last year in breast augmentation, at least in the United
Oh, how
States.
so?
And so, we've had the benefit now of being involved with a company that has been on the market, Motiva Establishment Labs.
Mhm,
They're a new breast implant that has come on the market as of September 2024,
mhm.
and it's kind of been an exciting change in the United States. But interestingly enough, that implant has been around the world for 15, 20 years, right?
Yeah, it's not new in the world, new in the US, but it has changed a lot of things, particularly in the fact that I don't know about you, but in my practice, Motiva is the first implant where patients are calling, specifically making sure that we do Motiva implants and are requesting it. I've never had that happen before in my practice. And it really shows how social media, in many ways, and their effective advertising campaign has driven a lot of awareness of this particular brand. Is that a unique phenomena to me, or have you seen that too?
No, absolutely. I think, that's one of the only breast implant manufacturers that I've seen direct to consumer marketing, right?
Yeah.
And, just for our listeners and viewers out there, the value proposition of Motiva has been this shell surface. Traditionally, we've had two shell surfaces, a smooth and a textured. And we all know that textured devices have been kind of falling out of favor for some of the risks
Mhm.
they've been having throughout the last 20 years. And what I would describe Motiva's surface as a plush surface, okay? It's a 4 micron surface, okay? And there have been in vitro studies looking at that surface and how it adheres to bacteria, because one of the things that can cause capsular contracture or scarring around the implant is microbacteria around the implant. And this 4 micron surface has been shown, at least on the benchtop, to reduce the clinging of bacteria to the surface. And we think that is going to be a huge thing when it comes to reducing capsular contracture risk. And what does the company tell us about capsular contracture in their implants?
Yeah, so their
Sam?
preliminary FDA data, or through 5 years, their data shows that the capsular contracture rate is less than 1%. But there's a little bit of comparing apples to oranges because with Mentor, Allergan, the length of study is much greater that's out there. So we think that through at least 5 years, the capsular contracture rate is lower than what we've seen with other implants, but it's too early to conclude that it's better over a longer period of time. The other thing they talk about is a very low rupture rate through 5 years, less than 1% as well. I'm not necessarily ready to declare that Motiva is the best implant out there, though I do like them quite a bit, but it is a great implant. But I think you would agree with this. It's one of many great implants that are probably out there. So, my question to you is, let's say you have a patient that's coming in and they are unassigned to their particular type of implant. They don't have a bias. How do you pick what implant's right for them? What brand?
Yeah. So great question. I think to me, it's a lot to do with the surgeon comfort level in the sizes that are out there. I mean, it's like I think each implant manufacturer probably has hundreds of sizes, right? And not every implant manufacturer has the size you're looking for, right? So to me, what's an important concept is size. Um, Mentor, one of the most popular manufacturers I've used ever since training, they're known for having XXL implants. I tend to use them quite a bit in breast reconstruction
Mhm.
in patients who have mastectomies. So patients who want really extra projection in the cosmetic world or have a very wide base width of their breast, I'll oftentimes use a Mentor device. Smaller augmentations, patients who come in that are younger, that haven't had breast cancer, obviously. There's kind of a push towards doing a natural or preservation type of breast augmentation. Those patients I'll kind of steer a little bit more towards Motiva these days.
Yeah. And I've used Allergan for years, and I think they're great implants. And I've used Motiva for a year, and I think it's a great implant. But there's a greater variety of implants with Allergan. They have a lower profile plus. If for patients that want a really natural look, sometimes that's the way to go, particularly if they have a wide chest wall width. There's a price difference between the implants too. I mean, Motiva is more expensive than the other implants that are out there as well, and so I think there's a lot of choices that are out there for patients, and they shouldn't have their heart set, in my mind, on one particular implant brand. One last thing I want to touch on is with Motiva implants and their low rate of capsule formation, I find myself using a lot more internal bras preemptively and prophylactically with breast augmentation. Do you find that as well?
So you make a great point. What has been the evolution of breast augmentation? I think even as soon as the last 5 to 6 years. And what we're seeing here is because a lot of these implants are coming out a bit softer, a little bit more natural, we're really trying to get away from putting implants underneath the muscle. And this sort of hints at the evolution of plastic surgery. Every it's like Madonna. You have to every 5 6 years you have to reinvent yourself, right? And so we placed implants on top of the muscle when we were in training. That shifted to underneath the muscle, and now we're kind of back underneath the fascia, right?
Mhm.
And so I think what I'm seeing and what I've been unhappy with throughout my career is some of the motion you see for patients, what we call pectoralis animation deformity. Athletic patients, thin patients, they may be moving and they say, I love my implants, but when I'm at the gym and I'm doing a bench press, they go off to the side,
Mhm.
right? And so these subfascial or subglandular augmentations, I think, are really nice. But there is a risk of these bottoming out over time because they don't have the support of being underneath the muscle. So I agree with you. More and more, I find myself using absorbable meshes or what we call biologic meshes that are made from various products, sheep tissue, pig tissue, etc.
Yeah.
So
And I think, because we know each other so well and we know each other's practices, you use more what are called acellular dermal matrices, which are artificial skin substitutes. I use more bioresorbable meshes, which are synthetic in nature. And we have our reasons for doing that. But I think what people need to know is, regardless of whether it's an acellular dermal matrix, that gets incorporated by the body. Regardless if it's a bioresorbable mesh, that eventually gets dissolved by the body, but gets replaced by scar tissue that's stronger than normal. There are ways to build in support to actually create a long-lasting result.
well, let me ask you a
Yeah.
question. What do you tell patients for recovery for breast augmentation?
I think breast augmentation is an operation where the recovery can be very quick, particularly now with a subfascial approach for patients. It's the sort of thing where I tell them, there are definitely surgeons that market a 24-hour recovery, and I see that a lot for patients. I'll tell them, we can do this on Friday. You'll be back at work on Monday, and you're going to feel great in about a week. But even though you're going to feel great in about a week, you're not allowed to work out for 3 weeks. That's my basic protocol.
Okay, now I want to give you a scenario. Last thing we're going to cover here. So let's say you got a 25-year-old patient and she comes in and she wants a breast augmentation. What kind of discussion are you going to have with her about the lifelong product that she has in her body?
Yeah. There is no lifetime devices, right? I think it's the important thing to understand is that breast implants are man-made devices. So by definition, they're going to have a problem at some point in their lifetime. Technology's getting better. So it's not going to necessarily be the sort of thing where they need it replaced in 10 years, which was, you know, kind of the old dogma in plastic surgery that you needed to get it done every 10 years. But at some point in their life, probably for this 25-year-old, when she's done having kids, she's going to need something done with her implants. And that might be due to capsular contracture, which is hardness. That might be due to them having gotten droopy or dropped a little bit. That might be due just to her wanting a change or more upper pole fullness. But likely 15, 20 years down the road, she'll need to do something. How about yourself?
Same. I say, at age 25, there's a good chance that at 10, 15, 20 years, you may have something wrong with the implant. And in fact, I'm going to leave with this. So one of the discussions I have with that 25-year-old is at some point, if you have to change this out, a lot of patients say, well, when I'm 60, I don't care. I'm not going to care what my
No,
breasts
they're
look like.
totally going to care.
They always care.
Exactly. Yes. Yeah. We're living longer. We're living healthier. And it's sometimes tough as the plastic surgeon, right? In the last month, I've seen 3 patients for consults who've come in because their implants have been in for 10 years. I didn't do any of their primary surgeries. And they're like, oh, it's 10 years. It's time for me to get my implants replaced. They all look great. I mean, selfishly, you're like, oh, I can operate on this patient. But you tell them, look, you're fine, as long as you're doing fine. And I use breast ultrasound. We confirmed that their implants weren't ruptured and they went on with their day.
So why don't we end with a toast? So here's to aging gracefully, and I hope your breast implants last forever.
Cheers.